You know, a big thing is healthcare professionals that, you know, has become a problem and that people are worried about is compassion fatigue, which is understandable. It's very hard to help people who appear that they don't want to be helped. In the setting that I work in, you know, when people are withdrawing and they're dope sick, they're not happy people. They are fidgety, they're angry, they're frustrated, they're sick, they're vomiting, they want to be left alone, they don't want to be left alone, they want to leave. You know, in those cases, I, you know, just try to remind my staff that, you know, they're here because they need help. And I think these days, it's hard to find somebody who doesn't know somebody who's been affected by it, whether it's first level, you know, like for me personally, you know, I lost my nephew and my daughter's father, both died of overdoses. And after that, I've had friends who've died, my best friend's brothers who've died. You know, everybody knows somebody who's been affected, which I think should push us to be kinder people and to be more understanding. I know that personally, through my experience and as I kind of mature through this whole process and my own grieving process with my nephew, it makes me want to do things more. I want to be more of an advocate. I want to be out there trying to help people, like doing stuff like this, or, you know, educating in ways, because it's a problem that's not going to go away, and I don't want to get burnt out for it. Right now, this is kind of a fuel that's driving me to do more, and I try to bring that out in the people around me, the professionals around me, the nurses around me, that we should be doing more to help. From my standpoint, like, we could be doing more as far as like protocol for opiate withdrawal. You know, where I work, we have alcohol withdrawal protocol, and if the order goes in, this person is an alcoholic, they're going to be withdrawing, because alcohol withdrawal is horrific. Like, a person could be ended up intubated in ICU. Like, it's bad. So we have a protocol to kind of combat that, and this is the steps you take. But it's not that with opioids, and it kind of leaves it up to the doctors individually. And lots of times you have residents who are covering them, or depending who the doctor is, it leaves it more up to them of how they feel like it's best managed. Like, some people would be like, absolutely no, we're not giving them narcotics, even though they might have surgery on their arm because they just had an abscess. We're not giving this heroin addict Dilaudid. Or, you know, delay in giving them Suboxone when we could be giving them Suboxone, and that could be right off the bat, and that could be helping them, or giving them some kind of benzodiazepine to help take the edge off, so they could, you know, calm down enough so they're not, you know, itching to leave and, you know, jonesing so much that they leave. I'd like to see more put in place and more of like a protocol that way, but I think it's an individual basis. What I would say to somebody who is a active addict is that drugs do not define who you are. Your addiction hasn't changed the person that you always were. For people who truly love you, there's nothing that you can do that they won't forgive or make you stop loving. I told you about that one kid who I talked about who woke up with a girl next to him in his grave. I think it was the first time I talked to a patient, or next to him, dead in his bed. I think that's the first patient I talked to about my nephew, because he's like, I don't care if I die or not. And I said, well, what about your mom? And he kind of got quiet. And I said, because my sister just buried her son. And I have to tell you how devastating it is, and how heartbreaking it is. And it's the kind of pain you don't get over. I said, I would never want to bury any of my children. I was like, you know, you just got to remember, it's not just about you. But I would just tell people that they could always make amends, that life is better, life is the choice that they should make. to a parent who has a child who's actively addicted to don't enable them, but don't give up on them either. What I would say to a grieving parent who just lost their child, I don't see, like, for me that's personal, because like I said, my sister buried her son and almost lost one of her other sons a few times to overdose. I don't know if there's anything you could say to make that pain go away. It's not their fault, but losing a child's got to be the worst pain I could ever imagine. For people to get more involved, I think, is to be aware of what's going on with you and around you. Like for me as a parent, I have a 15-year-old daughter. I didn't even know what a weed pen was until like recently. And I just found out that kids are smoking them in the bathrooms and like all the stuff that's out there. Like, you need to know what's going on with your kids. You need to know the things that are out there, because it's not the same world when we were their age. There's no more getting caught smoking cigarettes in the locker room or the bathroom. It's hitting the vape or hitting the pen and it being, completely unnoticed or unsensed. So I think it's to be aware of what's going around, to keep yourself educated, to keep an open forum with your children about what's going on. And for me, like all the children in my family, we've seen it, we lived it. We lived it when Matt passed away. We've seen it with my nephew Corey. So it's to try to make a negative situation a positive thing, like a positive education, like, how we should be treating people. One of the things, like with my kids, when my nephew was missing, my nephew went missing for 80 days before they found his body, and realized he died of an overdose. Every person standing on the corner panhandling, I would literally stop or slow down or tell one of the kids to, is that Matt? Is that Matt? Like, because we're like all on high alert. Now we stop and give people money, or we'll go and get McDonald's. And my kids are 6, 8, 15. I try to teach my children to be kind to people. We're all God's children, and if this was my child, this is how I'd want them to be treated. So it's kind of changed the way we do things. And I think that as society, we live in such a cold world that the more kindness that we could give, the better. That being said, there is like, a fine line between enabling and being, cold-hearted. But for me personally, what makes me so passionate about the way I feel about opioid awareness and addiction is the events that happened with my nephew. His name was Matt Stratton. He was my nephew, but he was only a year younger than me, so it's not like he was this young kid. He was 31 at the time. He had a back injury, which is so many reasons why people get addicted to medications to begin with, is medications that were prescribed. But like when he was like 20-something years old, he was doing roofing, and he sustained an injury that caused him to be permanently disabled. And Matt was like life of the party, super outgoing, baseball player, fun guy, and he went from being this person to being permanently disabled for the rest of his life and just overnight. So besides being on pain medications, in the combination of the pain medications, he started having seizures, which put him on, made him unable to drive. And as he was on more and more medications for pain, he became more and more depressed and mental health issues. I would have never thought Matt was a drug addict. I knew he had mental health issues. I knew he was taking like serious medications like methadone prescribed to him for pain. I never had thought that it turned into something so deep, like he was shooting up. I don't think anybody in my family really realized. he was having a very difficult time, and he ended up getting a DUI, so he's spending weekends in jail. And one weekend, my sister picked him up. My sister talked to him every day. She talked to him the day she picked him up on Sunday night. And, okay, I'll talk to you tomorrow. And she never talked to him, and she never heard from him. Went to his house. His door was unlocked. His dogs were there unattended for, and right away they knew something was wrong. Called the police multiple times to file a missing person report, because just knew that something wasn't right. Like, that wasn't like him to not touch base with anybody. It wasn't like him to not come home and feed his dogs or take care of his, his stuff. So we did. At one point we thought maybe he killed himself and we just haven't found the body, or maybe he got into some trouble with money with somebody. We had no idea what happened to him. We didn't even know he was associated with this doctor. It was 80 days. We did for his birthday. He was missing for his birthday, for Christmas, everything that we could possibly bring attention to, media-wise. We did a search down by the gorge, because that's where he was living at the time. Like I said, just thinking maybe he had killed himself somewhere near, and just looking for, that's a pretty gruesome and terrible thing to think, that we're organizing family and friends to come and try to find Matt's body, but that's what we were doing. And finally, my sister got a knock at the door one night, 80 days later, 80 days of missing. Like, think about like how terrible it feels to like lose your car keys, or to lose your favorite sweatshirt, not being, like, that kind of panic that sets in. But for it to be a human being, it is like undescribable, and I, to wake up every morning like hoping today is going to be the day we might hear from him, to that hope kind of dying off as the day goes by, like no word, you're calling everybody's, has anyone heard from anything, checking Facebook, making phone calls to people, to going to bed feeling completely devastated again, and having nightmares. I used to have nightmares every night, to wake up with that hope, to just have that, like, living that Groundhog Day every day is so much. I can't even imagine what it must have been like for her. But one night she got a knock on the door, and I remember that night I fell asleep on my couch, and my husband comes and he woke me up and he said, "You need to get up because they found Matt." And I remember thinking for a second, like, they found Matt, but then I realized they found Matt. And for 80 days he was buried in the backyard of a psychiatrist who had been a drug and alcohol counselor,
What's his name?
William Lewick. And when the day my sister went to, like I said, we don't know how Matt knew him or what the connection was. We didn't know, we didn't know how he ended up there. All we knew is that, like, somebody just discarded him like garbage. He buried him in his backyard and put lawn furniture over it and garbage to and was still seeing patients out of his house who walked by every day. Like, this person that we loved, not just loved, but like was part of us, That's when everything changed for me. Like I said, I didn't realize Matt was using drugs, but now it changes, like I said, every sad, broken person I see who's afflicted with this disease, this opioid disease, I just see my nephew in him, and I can't help it but open my heart and, do whatever I can. I'll do whatever. Our paths might just cross just for a few days, but I'm going to do what I can to help. and I'm going to continue, like whatever else. I'm going to be getting my BLS certification through the American Heart and Association, so I could train people how to do CPR. I'm going to continue to talk about it, because if this is the way to right a wrong for me, then it is. I feel like in the kind of honor of him and to make his memory kind of known. I don't know what else to say
Maybe
about
prevent other mothers from knowing you and your sister.
that. Yeah, like I said, it's personal. To me, the opioid crisis, it's very personal, and I'm kind of on a platform where I can do something about it professionally, with dealing with these people, and I'm going to keep preaching to whoever will listen. I don't see the trend slowing down at all, honestly. Like I said earlier, kids are being exposed to things way earlier, and it's not the stuff like that was around 20 years ago. It's all the synthetic things, all these pills that weren't around. I was thinking about it last night, and I actually, I remember when I was in nursing school being told that not to tell patients, there's only like a 1% chance of becoming addicted to pain medications after surgery. Like, don't worry about it. Take your pain meds as you need, blah, blah, blah. Now, it says right on our discharge instructions that there's a 1 in 4 chance of people who chronically use pain medication, prescription pain medication, will become addicted. I mean, there's a huge change in things in the last 15 years about the way we look at it. And like I said, it's just, it affects everybody, older people, younger people. I think our kids that are coming up, that are in the teenagers, are in for some challenges. And that's why I think it's even more important to be pushing this and pushing the awareness and talking about it, and because I think it's only going to get harder. I just think that we need to, like I said, my experience with losing Matt, just reminds me that, I'm not a deeply religious person. I don't preach God or anything like that, but I do feel spiritual, and I do kind of look at everybody like we are all God's children, and I love my children more than anything you could ever imagine could be loved, and that's how we should treat each other, like they're somebody's child, that's somebody's child, and one day that could be your child. And I think that we need to be a kinder, more compassionate society, and I think we need to be ready for a fight. We got some hard years coming ahead, and parents need to be watching their children, and they need to be, I don't know how to end that.
Yeah.
You gotta be ready. You gotta be ready for what's in store.